This is Strive to Thrive, and this is your weekly podcast designed to help improve your health, increase your success, and help you thrive in life. I'm Clarke Tanner, physical therapist, life coach, and founder of Thrive Physical Therapy.
And I'm Cody, physical therapist, working at Thrive for about a year and a half now. So we're going to talk to you guys today a little bit, something we're both very passionate about, and that's the idea of sleep hygiene and the importance of sleep, and how that can relate to your function, how that relates to your success, and how that can relate to your overall well-being.
So sleep is hugely important. We'll talk about some of the details of why, but I wanted to start out with a little bit of a story. So I had a patient that I'm working with fairly recently that I've worked with on and off for kind of various issues over the years. And this person always usually does pretty well. And this particular time, it was an issue with like a foot and a back thing. And she would kind of get a little bit better, but it would always just seem to come back. And then when we would examine her, things were absolutely looking better from a musculoskeletal standpoint, but yet it wasn't really improving. And so we kind of stopped and did a little bit of a re-exam and then had a conversation about what her life was like. And come to find out what was really happening is she was getting some things that happened. She was working with a new job, was having to commute a good ways in traffic each day. Her grandmother was sick, so she was traveling on weekends. So she was sitting a lot at work, being fairly stationary, and then traveling to see her grandmother on weekends. And the amount of sleep that she was getting, she was averaging about 4.5 to 5 hours a night. And so once we saw that, we realized, oh, okay, I see why we're not making any progress, because part of what happens is one side of the equation is things that we do that put stress into our system, our tissues, our connective tissue. Obviously, an injury where we would hurt someone, that damages tissues, but we can also get symptoms when nothing happened. And that would be because on the repair side, you're not able, your nutrition is maybe not solid enough. The sleep patterns is not solid enough to where now you're not restoring tissues on a daily basis when previously you were. So that's part of the reason things will come out. Well, anyway, to fast forward on this story, we had a conversation about that, talked about changing just a few things. And one of the first was to get her to sleep. Well, now she's doing very, very well. So we've made some really good progress with that. And that's been a pattern that I've seen. So Cody, how about you? Is that something that you've noticed with your people?
Yeah, I mean, I think for us, we noticed that, pain and sleep loss can be pretty highly linked. We've seen that, a lack of sleep and an increase in pain can be pretty well correlated, whether it be caused or not. But the idea is that basically your tissues restore while you sleep. So we heal at night. Typically during REM sleep is when we tend to have the highest rate of healing. If we can't recover our tissue, then even though you may move better, you may move further, your tissue may not be able to handle that stress because it actually hasn't repaired to the level or the same integrity that it had beforehand. So the idea behind that is if you don't sleep well, you can't repair. So you may move differently, you may change that aspect of your life, but the results won't be quite the same. And I've seen that happen on a constant basis for me as well, when someone may be doing relatively well on objective measure, but over time, we still see that the pain results don't catch up as well as we'd like. When we have that conversation about sleep, they tend to make a couple changes. We work on sleep pattern, phone use, blue light reduction, things like that. And then over time, that person starts to feel miraculously better, even though we're doing a very similar exercise program. So, yeah.
And some of the physiology behind that, but there are many actually health risks like coronary artery disease, different neuromuscular diseases, even Alzheimer's, that are heavily linked to chronic sleep deprivation. So we know through research has backed up in a huge way the importance of sleep. The sweet spot is really around 7 to 8 hours of sleep a night consistently. And part of the physiology around that is sleep deprivation and a lack of sleep increases our cortisol level, which is a stress hormone. That stress hormone and increased levels of that creates increased inflammatory mediators in the blood. And those two things. One is you get more inflammation, so things tend to hurt more. And two, that tends to sensitize our nervous system, and that's where you'll get the results with symptoms being elevated. So hugely important. So what are some things that you like to teach your patients in terms of how to get? I mean, obviously sleeping better is a big deal. So how do you get that to happen for your people?
Yeah. So a lot of time we start with just a conversation about usually nightly routine. A lot of time I'll find out that people are either performing habits that they've had for a long time, either late night phone usage before bed, starting a project well before the end, or exercising too late in the evening, where they may increase their nervous system response, increase their sympathetic system, which is your excitatory system, and then try to slow down and sleep, at a hard, bedtime and have a hard time getting to bed. So over time, I think the biggest thing for us is that when I have that conversation, that's where we start. We got to have a conversation. We got to talk about it. After that, we try to make a breakdown of how do we address those problems. And usually you don't want to try to do it all at once. If you can help it, making small changes over time tend to be a little bit more easy to stomach. And you have a little bit longer lasting success that way.
And so the other thing I had about it, do you teach anything in regards to positioning?
Yeah, of course. So we usually work on different positions that can help decrease stress. Now, if that person's dealing with like back pain or certain high stress points that they may be dealing with, we can work on using pillows to post and cushion, using different supportive sleeping positions to allow for that. We may talk about mattress and then maybe talk about what they're sleeping on, what they're dealing with. Are they sleeping in the same position every night? And just ways that we can help promote a better and more comfortable sleep. Hopefully they sleep longer throughout the night. They're not breaking their sleep cycle so often.
Yeah. And then what advice do you give somebody who maybe has difficulty having to get up and go to the bathroom a lot? Are there any piece of advice that you've got there?
Yeah, so we get that quite a bit. And I understand that's a very real concern. When someone has to use the restroom, constant throughout the night, really our suggestion is try to keep the light low. We don't want to go, when you turn on the lights, a lot of time that resets your circadian rhythm, especially if it's rhythmic and you do it often throughout the night. So it makes it harder to fall asleep at the time that you'd like because your brain thinks it's daytime, right? So one of the things that we want to do is try to keep the lights relatively low, as long as there's no vision problems in here. And we want to make sure that try to reduce the amount of phone utilization between the time that you're up using the bathroom and the time you get back going to bed. Just make sure that you keep the stimulus low. We want you to, maintain a quiet state and keep your nervous system deregulated or down, and that way you can go to bed a little bit easier.
So the key element, right, is not getting woken back up, right? And the other part to that, in terms of a general tip, is also decreasing your fluid intake past 6 o'clock. So obviously you want to hydrate during the day, but you don't want to drink a whole bunch of water or fluid right before you go to bed because then you end up having to go to the bathroom more often. So if you can kind of shut that down past 6 o'clock, if possible, unless there's some sort of medical reason that you can't. And then the other trick for not getting woken up is when you get back into bed, you go into a bit of a breathing pattern. So what you do is you want to, obviously your eyes are closed, you breathe in through your nose and out through your nose, and you want to have your exhale be twice as long as your inhale. So in other words, easy way to explain it is, if you inhale for 2 seconds, you want to exhale for 4 seconds in a nice relaxed way, all in through the nose and out through the nose with the tongue at the roof of the mouth. What that does is that lowers your blood pressure and relaxes your nervous system. And having that ready right away as soon as you get back into bed, if you start to notice you're trying to stay awake, that works beautifully in terms of knocking people right back out. So works really well. So just trying to get sustained sleep. The other part of sleep is it needs to be deep enough and for long enough that your pituitary gland secretes growth hormone. It has cyclically through the night. So for sleep to be maximally efficient, rather, and really kind of spur recovery of connective tissue, nervous system, et cetera, it has to be a long enough period of time and deep enough to actually be productive. So other things like difficulty with breathing, sleep apnea, there's other things that can contribute. So if someone's ever told you that you have trouble with breathing, you sound different when you breathe, that's also something that is worth checking out. But a good test to what is a good test in terms of telling whether somebody's getting sufficient amounts of sleep? What do you talk to people about?
So typically I just talk to them about their focus a lot of the time. Do they notice a difference in the way that they're performing at their job? Do they notice the way that they're feeling? They're engaging with relationships, with their family. I usually ask a little bit about anxiety and about stress. A lot of times sleep deprivation and stress are pretty positively correlated. So we like to see how that affects them. And this kind of gives me that same chance to say, yeah, it's an internal reflection of that process that lets me know where their head's at, lets me know where they think their deficits are, and also connects the dots where you can say, hey, I realize that I'm having some troubles with this area that I really care about, and that sleep may be the part of the problem, if not the problem, that I need to truly address. So I tend to have people just reflect a little bit more internally, check out, see where they think that may be causing some issues in their lifestyle, and work from there.
Yeah. So anyway, sleep is one of the absolute cornerstones of recovery. The other would be nutrition and diet, and we'll talk about some of those things in future talks. But one of the easiest ways to really help things to heal, feel more relaxed, less stressed during the day, and just feel good, have high energy, is simply just to get more sleep. The advice I usually give people is if they're trying to get something to heal is to try to get consistent sleep and then try to maybe get an hour more than what is typical for you. And that way you're just kind of priming the pump, so to speak, in regards to leaning towards your nervous system, restoring. So rest and digest, that's the part of the thing that we want to tune up. So sleep's a massive part of that, and can be a primary cause of why people have issues. So something to really think about.
Yeah, so that'll be kind of our lesson for Strive to Thrive today. So I appreciate you guys listening in. We'll keep posted and we'll keep producing more content.
Yeah, and everybody get out there and get some sleep. Got to recover. Take care. Thanks for listening, guys.